Hello everyone, I'm Dr. Farijarin. Today I'm going to talk about rheumatoid arthritis. Let's start. So here are some key points. What is rheumatoid arthritis? Clinical features, diagnosis, investigation, management, and bonus. This topic is rheumatoid arthritis versus psoriatic arthritis. These are the key points of today's video. So let's move further. What is rheumatoid arthritis? Rheumatoid arthritis is a chronic autoimmune disease that primarily affects the joints, causing pain, swelling, and stiffness, but it can also impact other body systems. But we need to remember some basic key points about rheumatoid arthritis. So these are chronic. So rheumatoid arthritis is basically chronic, progressive, erosive, destructive, and deforming disease. It is a deforming arthropathy. Basically, it is an arthropathy. So next, clinical features. We found pain and tenderness in joint. We found swelling, stiffness in the morning. Morning stiffness lasting 30 minutes. It's a hallmark of the rheumatoid arthritis. These are some basic features we get. And warmth and redness in firm joints. So basically we found pain and tenderness in the joint. We found swelling and stiffness in the morning. After waking up, we are unable to move our fingers or small joints. It is very difficult for the patient, and these are the features. And most importantly, rheumatoid arthritis commonly affects the same joints on both sides of the body. This is called symmetry, and symmetry is very important feature. Next, what joints are involved? Basically, metacarpophalangeal joint, proximal interphalangeal joint, and wrist. These are most these joints are most commonly involved. So here we can see the normal and rheumatoid arthritis joints. Here some difference we can see here. So deformities. What deformities we found? Most importantly, ulnar deviation. Fingers may bend towards the ulnar side of the little finger due to joint damage. Swan neck deformity characterized by hyperextension on the proximal interphalangeal joint and flexion at the distal phalangeal joint. Bartonier deformity involves the flexion at proximal interphalangeal joint and hyperextension at the distal interphalangeal joint. So here is a diagnostic criteria chart. I have marked some points. If a large joint involves, the score is 0. It's basically a scoring system. Uh, we have to we have to fulfill a score of 6 out of 10. More than 6 out of 10, if we found more than 6 out of 10 points are uh, matching, so it will be diagnosed as rheumatoid arthritis. Here are some. So if we found 1 to 3 small joints, the score is 2. These are the important points. So basically, small joint involvement is very important. Though according to new guideline, a large joint can involve, but small joints, as you see, score is very high. So chance of rheumatoid arthritis being is very high. So investigations, ACPA, the most specific rheumatic factor, 70% cases it will found positive, ESR, CBC, X-ray, and lastly C protein. So let's talk about the extra finding of rheumatoid arthritis. We found periarticular osteopenia, osteoporosis, erosion, subluxation, and let's talk about the prognosis. Poor prognostic features are rheumatoid nodule, erosion, rheumatic factor positive, anti-CCP antibody positive, that we called ACPA, and indicious onset. These are the poor prognostic features. So let's talk about the treatment of rheumatoid arthritis. We do treat the disease step by step. In first step, we give methotrexate and corticosteroid. In second step, we add DMARD if first step drugs are not giving the relief from the pain and sufferings. And on the third step, we give TNF alpha blocker after using more than 2 DMARDs. This is very important. And there's a name of DMARDs. These are methotrexate, sulfasalazine, leflunomide, and hydroxychloroquine. These are commonly used DMARDs in rheumatoid arthritis. Hi guys, I'm your doctor. If you like this video, please give a thumbs up, share, like, and comment below, and encourage me to make more and more videos. Thanks for watching.